Hi, I'm Shannon, and I'm going to go over PICC line and midline assessments. Whenever you have a patient with a PICC or midline, first things first, you want to go ahead and wash your hands and put on some clean gloves. If you come in, we're going to go ahead and assess the dressing and the site first. Just look to make sure that the date is good on your dressing, that the site does not have any redness or any drainage. If the dressing looks loose or soiled, it needs to be changed. So if it's soiled, I think of infection. If it's loose, I think of it accidentally getting pulled out. Another thing you want to kind of assess is if your patient has been feverish with no other signs and symptoms that we're thinking of potential PICC or midline infections. So those are the things you want to look at. So say everything looks good with your dressing and the site looks good. We're going to go ahead and we're going to assess the actual line before we give any medications to our patient. So this one we have Kuros caps on this one. So if you have a Kuros cap, you can go ahead and hook your saline directly in. If you don't, you can use either a site scrub or an alcohol prep pad and scrub the hub for 15 to 30 seconds, which is longer than most people think. So what I try to do is I sing happy birthday one time in my head, and that usually covers that. So this one has Kuros caps. So what we're gonna do is go ahead and take this off and hook up a saline. So if this is a central line, the first thing I'm gonna check for is a blood return. So I'll pull back just to see if I have a flashback of blood. If I don't, we can still flush to try to restore the blood return to a central line. But with a central line, the tip of the central line is in the superior vena cava, which is the biggest vein in the body. And a typical adult has 2,000 milliliters per minute of blood that runs through that area. So if a central line tip is where it's supposed to be and doing its job, an assessment on that is a blood return. If I don't have a blood return, you can flush with about 20 cc, see if you can restore the blood return. If you cannot restore the blood return, we need to assess and see why is it not getting a blood return, because that is the gold standard on a central line is to have a blood return on it. So I went ahead and pulled back and say I got a blood return. So now we're gonna flush it. What I do is one soft flush just to make sure I'm patent going in. Once I know it's patent, I take both of my thumbs and as hard as you possibly can, you wanna do push stop, push stop, push stop, push stop, push stop. And what that does, it makes the saline go in and around and in and around. And it's called a turbulent flush. It helps clean out the line. We're not just trying to flush around the stuff in there. We're trying to clean it. So that will help restore a blood return if you didn't get it. So you can try again if you didn't get it. If you're going to be flushing, you want to make sure to flush all ports because each one is different. So if you have a double lumen, you have to flush both, triple, all three. Once you've flushed all three ports, you go ahead and put fresh Kuros caps on, and then you're ready for your shift.